Good evening, everybody. Let's start today's lesson. Human Health and Diseases, second part. So after completion of yesterday's lesson, we start our first topic from AIDS. Acquired Immune Deficiency Syndrome. So the word AIDS stands for Acquired Immunodeficiency Syndrome. This means the deficiency of immune system that acquired during lifetime of an individual, indicating it is not a congenital disease. Remember this one. And it's a syndrome. You all know this one. Syndrome means group of symptoms are associated with this one. So AIDS is not a congenital disease, and the syndrome means the group of symptoms. It was first reported in 1981 and spread all over the world, and lot of people have died. 25 million person. So lot of people have died by this fatal disease that breaks our immunity. Then it's a viral disease. The causal organism is HIV, human immunodeficiency virus. It is a retrovirus. You all know what is retrovirus? When the presence of reverse transcripted from RNA, it can convert into DNA transformation. The envelope enclosing the RNA genome. Moving to our next slide, how the transmission of HIV are occurred. First cause, that is the sexual contact with the infected person by transfusion of contaminated blood and blood products, by sharing infected needles in case of intravenous drug abusers, and from infected mother to her child through placenta. So people who are at high risk getting this infection, those are multiple sexual partners, drug addicts who take drugs intravenously, and the individuals who require repeated blood transfusions, and the children born to an HIV infected mother. So that's very important. You have to remember lot of questions from this part. So moving to our next slide. It is important to note that HIV or AIDS is not spread by mere touch or physical contact. It's spread through body fluids. It is hence physical and psychological well-being that HIV and AIDS infected person is not isolated from family and the society. So that should be concerned to our mind, that they are not isolated. they are treated as a patient. So there is always a time lag between infection and appearance. That is very important thing. That is incubation period. The disease enter into the human body and the symptom are found. That period is called the incubation period. So always a time lag in the AIDS symptom. And not only this, think about this one, 5 to 10 years. So an infected person can know that he or she is infected 5 or 10 years ago. Sometime it can be affected when the immune system are getting damaged very rapidly in a few months within. So that is the structure of HIV. See, we already know it's a RNA genome. And the other components are present there. The capsid we already discussed. So take a screenshot, and this is the component that we all discussed, that it's a retrovirus due to presence of this enzyme reverse transcriptase. So take a screenshot, everyone. So the structure of HIV. Now, this is very important question in 2022 term 2. The retrovirus when entering into by normal viral infection, see, that enters, invade the plasma membrane and enters into the cytoplasm. The viral DNA is processed by reverse transcriptase and that are entered into the host genome. The new viral RNA is produced by the infected cell, and these viruses are produced and that can infect the other cell. Totally keep in mind this diagram of NCERT. That's very important for your exam this year. Keep it into mind, all the words intact, what is given there. So note down or take a screenshot. Now, the mechanism. So after getting into the body of person, the virus enters into macrophages. Where RNA genome of the virus replicates to form the viral DNA, which help the enzyme reverse transcriptase. This viral DNA get incorporated into the host DNA and direct the infected cell to produce the virus particle. The macrophages continue to produce virus and in this way act like just HIV factory. Simultaneously, HIV enter into the T lymphocyte. Here it replicate and produce the progeny viruses. These progeny viruses released in the blood attack the helper T lymphocytes. And this event is repeated in a progressive decrease in number of helper T lymphocytes in the body of the infected person. During this period, the person suffers from the fever, the diarrhea, and gradually lost its weight. Now the increase in number of viruses gradually decrease the number of helper T lymphocytes. The person starts suffering from infections that could have been otherwise overcome, such as those due to bacteria, especially mycobacterium viruses, fungi, and other parasites like toxoplasma. The patient become immunodeficient that are unable to protect themselves from those infection, and the diagnosis test, that is ELISA test, enzyme linked immunosorbent assay, some antiretroviral drug AZT are also there nowadays. They can only prolong the life, not cure the patient, that delay the death, but death is inevitable. So there are some measures that how we prevent the AIDS. In AIDS, actually no cure. The prevention is better than cure. We all know this one. So prevention is the best option. Moreover, HIV infection more often spread due to conscious behavior pattern and is not something that happens inadvertently, like pneumonia or typhoid. Of course, the infection in blood transfusion patients, the newborn, may take place due to poor monitoring. So the only excuse may ignore that it has been rightly said, do not die of ignorance. In our country, the NACO, the organization related with AIDS, National AIDS Control Organization, and other non-governmental organizations, lot of NGOs are working in this field to educate the people about the AIDS. World Health Organization started a number of programs to prevent the AIDS infection, making the blood that's safe from HIV. That's very important event. Ensuring the use of only disposable. It is already done all over the world. The use of disposable needle and syringes in public and private hospital and clinics, free distribution of condoms, controlling drug abuse, advocating safe sex and promoting a regular checkup for the susceptible persons, and some such steps are taken by the World Health Organization. So infection with HIV or having AIDS is something that should not be hidden, since then the infection may spread to many more people. HIV AIDS infected people need help and sympathy instead of being shunned by the society. Unless society recognizes it is a problem to be dealt with in a collective manner, the chances of widespread in the disease increase manyfold. So before moving to cancer, we are making the another important mechanism of AIDS. Look at here how the transmission of AIDS are there. So everybody draw the diagram with me. See the virus. That attaches to the host surface. So this is the first step. It entered there, and now the viral RNA is released here into the cytoplasm with the enzyme reverse transcriptase. Here the release of the virus. This is the viral RNA. Now, due to presence of reverse transcriptase, a double-stranded DNA are going to be copied here. So that's the viral DNA by the reverse transcriptase. Now the next step, the copied DNA insert into the host DNA. See, it enters into the host DNA. That's the entry point through nuclear pore. it getting entry, the copied DNA. Insert into the host and also makes copy during cell division. So they are going to make copy during cell division. Now after a latency period, so there it may take a break. So here the latency period we already discussed. The latency period, it may start from month to 5 to 10 years. Now from there, they become active. From there, it releases the RNA. New RNA are produced and lot of RNA and proteins, these are formed there. So these are the RNA. And some capsids are also formed. So new viral particle then assembled together. So they are assembled and they are forming a bud-like structure there after assembles. And the cell dies by infection. So that's the important steps how the transmission of AIDS occur inside our body. So if we summarize this one, what happened? The first, the virus attaches to the cell, that is the host cell. Number 2, virus enters the cell. Then viral RNA is released with reverse transcriptase is there. Next, a double-stranded DNA is formed from the single-stranded RNA. A double-stranded DNA is formed from single-stranded RNA by presence of the reverse transcriptase. Now the copied DNA, the DNA insert into the host DNA, the copied DNA, this one the copied DNA insert into the host DNA and make the copy during cell division. Next it move to the latency period and again active for a period of time. It may be 5 or 10 years later. Then new RNA is formed and viral proteins are formed. And these viral proteins are they use the host machinery. Next, the new viral particles assemble together. Virus particle comes out of the cell from the cell surface by forming bud, and at the end the cell dies off. Keep it into mind, the 10 points, that is the life cycle of HIV virus. Next, we are moving our next slide. Cancer. So cancer is one of the most treated disease of human being and is a major cause of death all over the globe. More than 1 million Indians, large number, are died from it annually. Now it is frequently came into news in our locality also that lot of people are facing the diseases. The mechanism that are underlie development of cancer or oncogenic transformation of cells. Oncogene, that is the gene related with cancer, and the study of cancer is called oncology. Its treatment and control have been some of the most intense areas of research in biology as well as in medicine. In our body, the cell growth and differentiation is highly controlled and regulated. Cancer, the breakdown of these regulatory mechanisms. Normal cells show a property that is very important, note down this one, contact inhibition, by virtue of which contact with other cell inhibits their uncontrolled growth. Cancer cell appears to have lost this property. So cancer cell have this property. To have lost their property as a result of this, cancerous cell just continue to divide, giving rise to masses of cell. As the contact inhibition are getting stopped, so the masses of cells are formed and causing the tumors. Now the tumors of different types, the tumors benign tumor and malignant or cancerous tumor. See the diagram how the tumor grows, and when they are transmitted through blood and lymph, in the diagram. So take a screenshot for your further knowledge. The benign tumors, we already discussed the two types of tumor. The benign tumors, they are confined to their original location and do not spread to other proliferation cells. These cells are called neoplastic cell, very important. These cells grow very rapidly, invading and damaging the surrounding normal tissues. As these cells actively divide and grow and also starve the normal cells by complete vital nutrients. Cells slaughtered from such tumors reach distant sites through blood, and wherever they get logged in the body, they start the new tumor there. So this property, when it transmitted through blood and lymph, that is called metastasis. This is the most feared property of malignant tumor. Very important thing to remember. What is metastasis? How it is fatal? Look at this one and keep it into your mind. So lot of causes are behind the cancer. It is still in the verge of research. Transformation of normal cells into cancerous neoplastic cells may be induced by physical, chemical and biological agents. These agents are causing cancer are collectively called carcinogens. The ionizing radiation like X-ray, the gamma ray, and non-ionizing like UV are cause the DNA damage leading the neoplastic transformation. This is the previously discussed topic, the neoplastic. By the test of biopsy test, we can detect that if it is a cancerous and does not obey the HEFIC limit, then it is easily curable in case of the benigns. Most of the cases benigns are localized but not cancerous. When it is cancerous, they may be treated into the treatment of cancer. But malignant, those are transmitted throughout the body, and when anything is localized into a particular position, that is very easy to terminate this one or amputate this one. By medicine, by rays, we can treat them and that is curable. Some benign tumors may cause cancer, that can be happen, but that can be treated and the patients are get cured, and lot of instances are there. So now moving to the next topic, the chemical carcinogen present in tobacco smoking have been identified as a major cause of lung cancer. The benzopyrene is very much there as a carcinogen in tobacco, the nicotine. Cancer causing viruses called oncogenic viruses have genes called viral oncogenes. Several genes, that is C-onc, cellular oncogene or proto-oncogenes, have been identified in normal cell which when activated under certain condition could lead to the oncogenic transformation. So remember this one. So C-onc, that is the cellular oncogene or P-oncogene that may present in normal cell, and they may be activated by the presence of different carcinogens or by ionizing radiation or by non-ionizing radiation. They may be transformed into oncogenic cells and causing cancer. Now the different carcinogens, lot of carcinogens and the target tissue, see this one. The shoots are causing their target organs to the skin and lungs. Coal tar, that causing skin and lungs. The benzopyrene is there. Cigarette smoker target tissue is the lungs. Cadmium oxide causing the target tissue, the prostate in male. From the fungi, aflatoxin causing cancer in liver. The poisonous gas causing cancer to lungs. Nickel and chromium component, they also cause cancer to lungs. Asbestosis, they also causing cancer to the lungs. The people working with these components, that is occupational disorder, we can say. DES causing cancer, vaginal cancer, and vinyl chloride causing cancer in liver of a body. So these are the target tissue and the major carcinogen that suffers human most. Now, cancer detection and diagnosis, if the early detection of the cancer, that is very essential, and that should be treated in the early condition and successfully in lot of cases. Based on biopsy and histopathological studies of the tissue, a blood and bone marrow test increase cell counts, that the blood cancer, the leukemia, that can be treated in the early stage. In biopsy, a piece of suspected tissue cut from the thin section and stained and examined under microscope, that is called the histopathological studies by the pathologist. The techniques like radiography, use of X-ray, computed tomography, the magnetic resonance imaging are very useful to detect the cancer in the internal organs. CT uses X-ray to generate 3D image of the internal organ. And MRI uses strong magnetic field and non-ionizing radiation to accurately detect, that is very effective. MRI accurately detect the pathological and psychological changes in the living tissues. So keep it into mind, the different techniques of cancer detection and their diagnosis. Antibodies against cancer specific antigen is also used for detection. Nowadays, the techniques of molecular biology can apply to detect the genes of individual which had inherited susceptibility to certain cancer. After identifying of such gene, an individual to certain cancer may be helpful to prevent cancer, and such individuals may be advised to avoid exposure to particular carcinogen on which they are susceptible. So those peoples having the inherited susceptibility of a particular type of cancer, if it is detected, so now someone detected the susceptibility in the tobacco smoking, so if it is advised him not to take this carcinogen or not to come in contact with this one, it may be avoided, or he or she may not be affected by cancer. In modern days, lot of treatment measures of cancer. The common approaches, that is surgery, radiation therapy mostly used, and radiotherapy. The tumor cells are irradiated lethally, taking proper care of the normal tissues surrounding the tumor mass. That is the way of radiotherapy. Chemotherapeutic drugs to kill the cancerous cell. Some of these are specific for particular tumors. Majority of drugs have side effects. We know this one, lot of cancerous patients on their way of treatment, they are facing the hair loss, they may be anemic, etc. Most cancers are treated by combination of surgery, radiotherapy and chemotherapy. Tumor cells have been shown to avoid detection and destruction by immune system. Therefore, the patient are given substances called biological response modifier. Biological response modifiers such as alpha interferon, which activate their immune system and help in destroying the tumor. That is very important to remember. Alpha interferon user. Biological response modifier. Now coming to our last topic, that is the drugs and alcohol abuse. So everybody, are you all listening? Lot of people are there in the first page, but I want all of you. Now the introductory page of alcoholism and drug abuse. Surveys and statistics show that the use of drugs and alcohol has been on the rise of, especially among the youth. So this is really a cause of concern, as it could result in many harmful effects. So proper education and guidance would enable youth to safeguard themselves against this dangerous behavior pattern and follow the healthy lifestyles. So this is why this topic is introduced in the adolescence period of all of you. The drugs which are commonly abused, the opioids, the cannabinoids, the coca alkaloids, majority of these are obtained from flowering plants. keep it into your mind. Some are obtained from fungi, mostly the plant group, flowering plants and some fungi. So here is a unique chart to remember this one, the type of drugs. So the sedatives and the tranquilizer used as depressants, opiate narcotics, stimulants and hallucinogens. Remember this one. Every time from this part we get one or two questions from there. So keep it into mind. The sedative and tranquilizer, the barbiturates, the benzodiazepine, that's the Valium. What's the effect of the sedative drugs? They depress the brain activity and produce feeling of calmness. Feeling of calmness, not the proper calmness. Relaxation, drowsiness, deep sleep when it taking high doses. Sometimes this medicine used as medicine in clinical anti-anxiety medicine. Opiate narcotics, the opium, morphine, heroin, pethidine, methadone, they suppress the brain function and relieve some intense pain. You know the morphine injections are injected in the patient after massive operation. Stimulant, the caffeine, it's a very mild stimulant. Amphetamines, cocaine and its derivative. So when it is stimulant, so definitely stimulate the nervous system, make a person more awakeful, increase alertness and produce excitement. Sometimes it is clinically used for attention deficit stimulant, narcolepsy and weight control, that should be prescribed. The last one, the hallucinogens, the LSD. So can you tell me the full form of LSD, anyone? That is lysergic acid diethylamide, mescaline, phycocyamin, charos, harish, marijuana. No clinical use of hallucination. Actually, people are taking for their altered thoughts and getting the feeling and perception of hallucination. Now some drugs, especially opioids, which bind to specific opioid receptor present in our CNS and GI tract. Heroin is commonly known as smack. Remember this one? It's chemically diacetyl morphine, which is white, odorless, bitter crystalline compound. They are obtained by acetylation of morphine, which is extracted from the latex of the poppy plant, scientific name Papaver somniferum. They are generally taken by, that is obtained from the coca plant, Erythroxylon coca. Mostly it is native to the South America. It interferes with the transport of neurotransmitter dopamine. Cocaine, normally called coke or crack, is usually snorted. That is act on our central nervous system and producing a sense of euphoria and increasing energy. Excessive dose of cocaine cause hallucinations. Other well-known plants for hallucination property, that is atropa, belladonna and datura. Some other drugs are there, the barbiturates, amphetamine, benzodiazepine. These are normally used as medicines to help the patient cope with the mental illness like depression as well as insomnia patient. But these are often abused. Morphine is another effective sedative and painkiller, very useful to the patient who are having undergone a massive surgery. Several plant fruit seeds taken as a hallucinogenic properties and used hundreds of years. Different types of folk medicine, religious ceremonies and rituals all over the globe. When these are taken for the purpose of other than medicinal use, and frequently that impairs one physical, mental and psychological function, it constitutes the drug abuse. Keep it into mind. Why it is called the abuse? Smoking also paves the way to hard drug. Tobacco has been used by human being for more than 400 years. So look at this one. It is smoked, chewed and used as snuff also. Tobacco contains large number of chemical substances including nicotine. It's an alkaloid, nitrogenous excretory substance of plant. Nicotine, which part of our body are stimulated? That is the adrenal gland. To release the adrenaline and noradrenaline into the blood circulation and both raise the blood pressure and as well as it increase the heart rate. It causing the cancer in lungs, urinary bladder, throat, bronchitis, emphysema, CHD, coronary heart disease and ulcer in the gastric part of our body. Tobacco chewing is the cancer in the oral cavity. The smokers are always increase the CO content in blood. So when the CO are increasing in someone's blood, it reduces the concentration of inbound oxygen. That causes the oxygen deficiency in our body. The smokers are often faced with this problem. Now these are some constituents that causing different effect. These are carcinogenic component and their effects are there. So take a screenshot for further reference. So the adolescence and the drug and alcohol abuse. So adolescence, you know, a period or a process of during the child become mature in his attitude, belief and the participation in the society. the period between 12 to 18 years of age. The adolescent period, it may be differ in different way, but stick it into your mind from 12 to 18 years. In the human development, starting from the infancy, then childhood, then adolescence, then adulthood and senescence. This is the third phase in our life, the adolescence. That is the linking between childhood and adulthood. A lot of biological and behavioral changes are there in this period. It's a very vulnerable phase, and mental as well as the psychological development of an individual. Because the pupils are very curious, they need for adventure. They are getting excited to use a new one. Sometimes they are going to experiment with the different types of drugs. So, in modern days, you all know, the peoples are very much mobilized by their heroes. Those are taking the different types of smoking and the chewing components. So that's the problem of adolescence. A child's naturally curious motivates to his experiment. This is complicated further by effects that might be perceived as benefits of alcohol or drug use. Thus, the first use of drug may be out of curiosity, but later the child starts using these to escape facing problems. Of late, the stress, pressure to excel the academics in an examination has played a significant role in persuading the youngster to try alcohol and drugs. But this is not the way to escape from this one. The perception among youth that it is cool or progressive to smoke, use drug or alcohol is also the way of major cause of youth to start this habit. Television, movies, newspaper, internet, they all help to promote this perception. Other factors that have been seen to be associated with drug and alcohol abuse among the adolescents are unstable or unsupportive family structure, as well as, you know this one, the peer pressure. So lot of effects of drug and alcohol abuse. The immediate adverse effect of drug and alcohol are manifested in the form of the reckless behavior, vandalism, violence. Excess use of drug may lead to coma due to respiratory failure and cause the cerebral hemorrhage. So most common warning signs of drug in the youngster including the drop of academic performance. Sometimes their absence, unexplained absence from the school and college. Lack of interest in personal hygiene, withdrawal, isolation, depression, fatigueness, and aggressive and rebellious behavior. So these are the symptoms in normal day that the people are aware that he or she is facing some problem with effect of drug or alcohol. So there may even be some far-reaching implication. If an abuser is unable to get money or buy drugs, he may or she may turn to stealing. That's the another social effect of drug. The adverse effect was just not restricted to the person who is using drug or alcohol. At times, a drug or alcohol addict becomes the cause of the mental and financial distress of his entire family and friends as well as the society. So the immediate adverse effect of alcohol use, the manifested in the form of reckless behavior, we already discussed this one. So drop of, we are summation, drop of academic performance, unexplained absence, lack of interest, withdrawal, isolation and depression, deteriorating relationship with family and friends, loss of interest in hobbies, and changing in sleeping and eating habits. So this is the summation from the previous paragraph. Keep it into mind. So there may be some far-reaching implications in drug and alcohol use. If an abuser is unable to get money, he may turn to stealing. So this is all discussed earlier. Those are taking intravenously drugs, they may be infected by AIDS and hepatitis. They are causing, so due to drug abuse, unknowingly he is infected by AIDS and hepatitis. So sometimes alcohol during adolescence may have long-term effect. The chronic diseases are there, that is the liver cirrhosis. The sportsmen, we all know, lot of sportsmen are getting diverted from their sports career due to taking of this type of drugs. Sometimes they are totally detached from this arena. They are punishable offense by taking the drugs. The misuse of narcotic analgesic, anabolic steroids, diuretics, thus in sports increase the muscle strength, the aggressiveness. Sometimes they are used this one to increase their performance. In males include increased aggressiveness, mood swing, depression are there. These effects may be permanent and prolonged use in adolescent male or female. Several facial and body aching, premature closure and growth centers for a long bones may result stunted growth. So we avoid undue peer pressure. Education and counseling is needed. Seeking help from the parents and peers. So all the points are to be noted. That's very important for our turn to. That is the prevention and control measures. Looking for danger signs. All parents and teachers need to look for the identity, the danger signs of discussive above. Even friends, if they find someone using the drug or alcohol, should not hesitate to being noticed to the parents or teacher. That is our social duty. The seeking professional and medical help, that is also going all over the world. Now, at the end of our lesson, here is a concept map for you. Here is a concept map for you. So take a screenshot, that will help you in your exam. In a single page, all these are there. So take everyone a screenshot. Taken. So that's the concept map of this chapter, Human Health and Diseases. So from this, We came to end our lesson. Here is some important questions for you. Note down this one. From this chapter, everybody note down. So everybody go through the stages of in the life cycle of Plasmodium. Prevention and control of infectious diseases. Mosquito borne diseases and prevention. Function of cytokine barrier. That provide the innate immunity. Function of interferons. Symptoms of ascariasis, colostrum, and how it provide immunity to a newborn baby. Common approaches for treatment of cancer. different drugs and their source. Long answer. What could be far-reaching implications of drug and alcohol abuse? With this, what is withdrawal syndrome? Effect of drug and alcohol use. This type of questions are there. The another important things, that is structure of antibody. Human immune system with their location and which we discussed previously, the replication of retrovirus. The flow chart is very important, and acquired and passive immunity, acquired immunity and passive immunity, very important. Primary response, primary and secondary response, cell-mediated immunity and humoral immunity. So these are the important questions from this chapter. And the last one, that is the life cycle of Plasmodium vivax. Life cycle. That's very important. The diagram is very important related to this one. and with this the cancer detection and the approaches, the common approaches for treatment of cancer. So everybody note down this one. Have life cycle and phases. These are same. The different phases that is given, that is already we have done in classes. The mosquito host and human host both are there in Plasmodium vivax. The digeneticness, that is the human phase and mosquito phase in flowchart. So I think we all cleared this one, this chapter. So next day we start from the next chapter in our term 2 syllabus, that is microbes in human welfare. So tomorrow in same time we meet again for discuss the chapter number 10, microbes in human welfare. Till then, goodbye everybody and best of luck to the KVPY, SA and SX candidates. Many of you are going tomorrow. I will be there in your center. So tomorrow we meet again in the arena of KVPY. So keep it into mind. You have to score more than 70 marks because this year no interview are taken for KVPY. So it's a high scoring examination. So try to select yourself as a KVPY successor. Till then, bye everybody. Good night.